We often hear people say, "Oh, I have IBS," when experiencing digestive discomfort. But what they might not realize is that irritable bowel syndrome, or IBS, is different from inflammatory bowel disease, or IBD. While both involve the gut and can cause discomfort, they are distinct conditions. Imagine mistaking a cold for the flu. They share some symptoms but have different causes and treatments. Similarly, IBD and IBS, though often confused, are not the same. Understanding the difference between these two conditions is crucial for seeking appropriate medical advice and management strategies. Inflammatory bowel disease, or IBD, is not merely a nuisance. It's a chronic condition that affects millions worldwide. IBD is a group of disorders characterized by chronic inflammation in the digestive tract. Unlike IBS, which is a functional disorder, IBD involves an immune system malfunction. In IBD, the body's immune system mistakenly attacks the digestive tract, leading to chronic inflammation. This inflammation can cause ulcers, scarring, and other damage to the digestive tract, leading to a range of uncomfortable and often painful symptoms. Imagine living with the constant fear of experiencing a flare-up, the uncertainty of what each day might bring. IBD presents a significant challenge, both for those living with it and for healthcare professionals seeking effective treatments. It's a complex condition with a wide range of symptoms, making diagnosis and management particularly difficult. Despite the challenges, significant progress has been made in understanding and treating IBD. Researchers are continually working to develop new therapies and improve the lives of those affected by this chronic condition.
Dr. Valentino to the OR, please. Dr. Valentino to the OR, please.
Inflammatory bowel disease, often shortened to IBD, is not a single disease, but rather an umbrella term. It encompasses a group of disorders that share a common thread: chronic inflammation of the digestive tract. This inflammation isn't a fleeting response to a spicy meal. It's a persistent issue that can lead to long-term damage. The two main types of IBD are ulcerative colitis and Crohn's disease. While they share the common ground of inflammation, they differ in the areas of the digestive tract they affect and the way this inflammation manifests. Understanding these differences is crucial for accurate diagnosis and effective treatment. Similarly, ulcerative colitis and Crohn's disease demand tailored treatment plans to manage their unique characteristics. Ulcerative colitis focuses its attack on the colon, also known as the large intestine, the final part of the digestive tract. This inflammation primarily affects the innermost lining of the colon, leading to the formation of ulcers or open sores. The inflammation in ulcerative colitis typically begins in the rectum, the last part of the colon, and may gradually extend upwards, affecting part or even the entire colon. This continuous spread distinguishes ulcerative colitis from Crohn's disease, which tends to affect the digestive tract in patches. The constant irritation and damage to the colon's lining cause abdominal cramps, pain, and an urgent need to empty the bowels, significantly impacting daily life. Crohn's disease, unlike ulcerative colitis, doesn't limit itself to a specific area of the digestive tract. It can affect any part, from mouth to anus, though it most commonly targets the end of the small intestine and the beginning of the colon. Another distinctive feature of Crohn's disease is its depth of penetration. While ulcerative colitis primarily affects the innermost lining of the colon, Crohn's disease can penetrate deeper, affecting the entire wall of the digestive tract. This deep-seated inflammation often leads to complications like strictures, which are narrowings of the digestive tract, and fistulas, abnormal connections between different parts of the digestive tract or even to other organs. The inflammation can cause a range of symptoms, including abdominal pain, diarrhea, weight loss, fatigue, and malnutrition, significantly impacting a person's quality of life. Diagnosing IBD is like putting together a complex jigsaw puzzle. There's no single test. Instead, it requires a combination of medical history, physical examination, and a battery of tests. Doctors rely on a combination of tools, including blood tests, stool tests, endoscopy, and imaging scans, to arrive at an accurate diagnosis. The symptoms of IBD can mimic other conditions, making it crucial to rule out other possibilities and ensure a correct diagnosis. Receiving an IBD diagnosis can be overwhelming, often accompanied by a mix of emotions, fear, uncertainty, even relief at finally having an explanation for persistent symptoms. With the right treatment plan and support, individuals with IBD can live full and active lives. Imagine waking up every morning uncertain of how your body will behave. Will you have the energy to go about your day, or will you be confined to the bathroom, crippled by abdominal cramps? This is the reality for millions living with inflammatory bowel disease, a chronic condition that casts a long shadow over daily life. The unpredictable nature of IBD flare-ups can make even the simplest tasks, like going to work or socializing with friends, seem daunting. The constant fear of experiencing a flare-up in public, the urgency to be near a bathroom at all times, and the exhaustion that comes with chronic inflammation can significantly impact an individual's quality of life. IBD manifests in a myriad of ways, with symptoms ranging from mild discomfort to debilitating pain. Diarrhea, often bloody and accompanied by mucus, is a hallmark of the condition. The constant urge to empty the bowels can be incredibly disruptive, leading to anxiety and social isolation. Abdominal pain, often described as cramping or stabbing, is another common symptom. The inflammation in the digestive tract can also cause nausea, vomiting, and loss of appetite, leading to weight loss and malnutrition. These extra-intestinal manifestations highlight the systemic nature of IBD, emphasizing that it's not just a gut issue, but a condition that can affect the entire body. The impact of IBD extends far beyond physical discomfort. Living with a chronic, unpredictable illness like IBD can take a toll on mental health, leading to anxiety, depression, and social isolation. The constant worry about symptoms, the limitations imposed by the disease, and the side effects of medications can create a vicious cycle, negatively impacting emotional well-being. Relationships can also suffer as individuals with IBD may withdraw from social activities due to fear of flare-ups or embarrassment about their symptoms. The unpredictable nature of the disease can make it difficult to maintain commitments, leading to misunderstandings and strained relationships. The cost of medications, doctor's appointments, and hospitalizations can place a heavy financial burden on individuals and families. Despite the challenges, individuals with IBD can live full and active lives by adopting coping mechanisms and seeking appropriate support. Working closely with a healthcare team, including a gastroenterologist, dietitian, and mental health professional, is crucial for managing symptoms, addressing nutritional deficiencies, and providing emotional support. Lifestyle modifications, such as stress reduction techniques, regular exercise, and a balanced diet, can also play a significant role in managing IBD symptoms. Support groups, online forums, and patient advocacy organizations offer platforms for individuals with IBD to share their experiences, exchange coping strategies, and find solace in knowing they are not alone. Inflammatory bowel disease, with its complex interplay of symptoms and far-reaching impact, has puzzled the medical community for decades. While a single definitive cause remains elusive, researchers have made significant strides in understanding the factors that contribute to its development. Unlike a simple infection with a clear-cut cause, IBD appears to arise from a complex interplay of genetic predisposition, environmental triggers, and a misdirected immune response. It's like a recipe gone awry, where multiple ingredients combine to create an undesirable outcome. Understanding these factors is crucial for developing effective prevention strategies and targeted treatments for IBD. By exploring these factors, we can better understand who is at risk, identify potential triggers, and develop personalized approaches to manage and potentially prevent this debilitating condition. Our genes, the blueprint inherited from our parents, play a significant role in shaping our health, including our susceptibility to certain diseases. IBD is no exception. While it's not strictly a hereditary disease like cystic fibrosis, where a single gene mutation guarantees inheritance, genetics does play a crucial role in determining an individual's risk of developing IBD. Research suggests that individuals with a family history of IBD are at a significantly higher risk of developing the condition themselves. This familial clustering points to a genetic component, suggesting that certain genes may make individuals more susceptible to the immune system malfunction that characterizes IBD. However, it's important to note that genes are not destiny. Environmental factors and lifestyle choices also play crucial roles in determining whether someone with a genetic predisposition will actually develop IBD. While our genes lay the foundation, environmental factors and lifestyle choices act as triggers, influencing whether or not inflammatory bowel disease or IBD develops in individuals with a genetic predisposition. Think of it like this: a pile of dry leaves is more likely to catch fire than a pile of wet leaves, even if both are exposed to a spark. Similarly, certain environmental factors and lifestyle choices can fan the flames of inflammation in individuals genetically predisposed to IBD. Factors like diet, smoking, stress, and even exposure to certain viruses and bacteria have been implicated in the development of IBD. For example, diets high in processed foods, saturated fats, and sugar have been linked to an increased risk of IBD, while diets rich in fruits, vegetables, and fiber seem to offer some protection. These environmental triggers highlight the complex interplay between our genes and the world around us, emphasizing the need for a holistic approach to IBD prevention and management. The immune system, our body's internal defense force, plays a paradoxical role in IBD. While its primary function is to protect us from harmful invaders like bacteria and viruses, in IBD, the immune system seems to misfire, mistaking harmless substances in the gut, like food particles and beneficial bacteria, as threats. This immune system malfunction leads to chronic inflammation, the hallmark of IBD. Immune cells flood the lining of the digestive tract, releasing inflammatory chemicals that cause pain, ulcerations, and other damage. While the exact reasons for this immune system misdirection remain unclear, researchers believe a combination of genetic predisposition, environmental triggers, and disruptions in the gut microbiome may be responsible for setting off this immune cascade. Current treatments often focus on suppressing the immune response to reduce inflammation, but future research aims to develop more precise therapies that address the root cause of this immune system misfire. Section 1. Navigating the treatment landscape of IBD. Imagine standing at the foot of a mountain, unsure of the best path to take. Navigating IBD treatment can feel like this for patients and healthcare providers. There's no one-size-fits-all cure. Managing IBD involves finding the right combination of treatments to control inflammation and improve quality of life. Treatment plans are tailored to the type of IBD, symptom severity, and individual health. Think of it like a jigsaw puzzle, with each piece representing a different treatment. The goal is to achieve and maintain remission, where symptoms are minimal or absent. achieving remission often requires a multifaceted approach, combining medical treatments with lifestyle modifications and emotional support. Medications are the cornerstone of IBD treatment, acting like firefighters to dampen inflammation in the digestive tract. They work by suppressing the immune response, reducing inflammation, or targeting specific pathways. Each medication serves a specific purpose, like tools in a toolbox. Aminosalicylates reduce inflammation in the digestive tract lining. Corticosteroids quickly control severe flare-ups but have significant side effects. They are used short-term to manage acute inflammation. Immunomodulators and biologics are for moderate to severe IBD. They suppress the immune system or target specific inflammatory molecules. These medications offer the chance for long-term remission. However, they can have serious side effects and are reserved for those unresponsive to other treatments. Surgery is sometimes necessary for IBD, especially with complications like fistulas, strictures, or severe inflammation. It's a last resort when other treatments fail. Surgery type depends on disease location and severity. Proctocolectomy may be an option for ulcerative colitis. It results in a permanent ostomy. Crohn's disease can recur elsewhere. Surgery may remove damaged sections or repair fistulas. Minimally invasive techniques shorten recovery times. While medications and surgery play crucial roles in IBD treatment, lifestyle modifications are equally important in managing symptoms, preventing flare-ups, and improving overall quality of life. Think of lifestyle modifications as complementary therapies, working in synergy with conventional medical treatments to provide a holistic approach to IBD management. Diet plays a crucial role in IBD management, as certain foods can trigger or worsen symptoms. While there's no single IBD diet, many individuals find that identifying and avoiding trigger foods, such as spicy foods, caffeine, and alcohol, can help manage symptoms. Eating smaller, more frequent meals, staying hydrated, and ensuring adequate intake of fiber and nutrients are also essential for gut health. Stress management is another crucial aspect of IBD management, as stress can exacerbate symptoms and trigger flare-ups. Engaging in stress-reducing activities like yoga, meditation, deep breathing exercises, or spending time in nature can help calm the mind and body, reducing the impact of stress on IBD. Regular exercise, even moderate activity like walking or swimming, can also help reduce stress, improve mood, and promote overall well-being. Living well with IBD. IBD is a chronic condition, but it doesn't have to define your life. Despite challenges, you can live a full and meaningful life. Like a ship in a storm, with the right approach, you can reach calm waters. Take control, work with healthcare providers, and make informed decisions. Embrace a holistic approach, balancing physical, emotional, and social well-being. Find coping mechanisms, build support, and focus on positives. The horizon of hope. Advancements in IBD management. The landscape of IBD management is evolving, offering hope for individuals living with this chronic condition. Today, advancements in research, diagnostics, and therapies are transforming IBD management. Personalized medicine tailors treatments to an individual's unique genetic makeup. New medications and targeted therapies offer more effective treatment options. Advanced imaging and minimally invasive surgeries improve diagnosis and recovery. The future of IBD management is bright, driven by ongoing research. Empowering individuals. Knowledge as a tool. In the realm of health, knowledge is power. Understanding inflammatory bowel disease, or IBD, its causes, symptoms, treatment options, and potential impact on daily life is empowering. It allows individuals to take an active role in managing their health, making informed decisions about their care, and advocating for their needs. Imagine a world where individuals with IBD feel confident discussing their condition with healthcare providers, asking questions, and seeking clarification. A world where they feel empowered to make informed decisions about medications, surgeries, and lifestyle modifications, weighing the risks and benefits based on their individual circumstances. This empowerment extends beyond the doctor's office, spilling over into other aspects of life. Knowledge about IBD allows individuals to educate their families, friends, and colleagues, fostering understanding and support. It enables them to identify potential triggers, adapt their lifestyles, and develop coping mechanisms to navigate the challenges of living with a chronic condition. Striving for a world without IBD. Researchers are working tirelessly to unravel the mysteries of IBD. Imagine a world where children no longer face the challenges of IBD, a world where remission is a reality for everyone. Achieving this vision requires continued investment in research. The journey is long, but the destination is worth striving for.